Feel your body next to mine. Boy, I need you now. I just wanna be here by your side.
Well, thank you for having me. Good evening, everyone. And my name is Whitney Lupton. I am the Chief Marketing Officer of the TCP Network, and what we do is entrepreneurial journalism. Tonight, I want to welcome our esteemed speakers, our panelists. First up, we have Dr. Tina Ward. In 2000, she opened her own practice in Austin, and then she sold it in 2008 to pursue other interests and spend more time with family. Dr. Ward currently serves as president of the newly formed nonprofit organization, Austin Black Physicians Association, or ABPA, which is dedicated to the health and education of the African American and underserved communities.
Thank you again for the invitation. I love talking to our public about all the things we need to do to get through this entire pandemic. So I'm happy to be here.
Guys, again, that was Dr. Tina Ward. Our other esteemed guest and panelist and speaker is Dr. DeVry Anderson. He is an experienced and inspirational corporate leader, providing organization-wide leadership for all hospital medical functions in one of the largest health systems in Texas, offering a range of complex specialties and subspecialties.
I'm just honored to be here in this group, excited to talk to you all and just to be a part of the conversation. Excited to be partnered with Tina. She's an amazing physician, so thankful for this opportunity.
And thank you for taking the time to share what you have discovered and being able to share this information with the community at large. Austin, thanks you for it. Let's get started with some of these questions. Our first question that we have is about social distancing and mask mandates. Should they be the new norm for employers?
I'd like to say yes, especially right now. Until we end up with enough umbrella or herd immunity that everybody's been vaccinated, enough people that we can safely, congregate together, I would say yes. We really need to be encouraging people to use masks and social distance. It's the only way to stay safe right now.
Okay. Employers are going to be open for business, regardless of size. Do you think that there should be an investment into more hand washing or sanitizing stations on the premises?
Absolutely. I mean, increased investment is a question. You have to figure out what they're already investing, but surely we want to ensure that anybody who's patronizing your business or working in your business has the facilities to wash their hands, has the ability to be distanced. I think it's important to have masks on the premises, so if for whatever reason your staff or your customers don't have masks, you can provide them. Those things are going to be very important to date.
A lot of places are requiring masks, and there are some places that are doing the temperature checks. How effective are the temperature checks when visiting different businesses?
I think it's a pretty good strategy that people are using, as long as you start to recognize that there's a lot of asymptomatic people. So don't expect that performing those are going to be completely effective, because people are going to have no fever and still be a carrier of COVID-19. So just consider that. And another thing I would recommend is that you start letting people self-screen, that they start talking about the signs and symptoms that they have before they come in. Fever, cough, shortness of breath, new symptoms, loss of sense of taste and smell, different things like that. It's important to let them self-screen so that they can admit to things that are going on early so you can catch it.
That's the first time that I've heard of that term, self-screening, as far as like employees really having that opportunity to do that for themselves. How do you think it would be possible for employers to effectively enforce self-screening with employees?
I think that you have to have a relationship with your staff and have them understand the importance of doing that it's going to keep them safe as well as the other employees safe. So as long as people feel responsible for that, I think it's going to be extremely effective. It's more effective than letting them call in sick and make them feel like they really have to report to work when they're sick and then putting everybody at risk. So consider the alternative. DeVry's the COO at South Austin Hospital. You're doing temperature checks, aren't you?
We are doing temperature checks, but the question is whether or not the temperature checks are truly
clinically efficacious. Temperature checks are not going to prevent COVID, and they're really a poor diagnostic tool for COVID. Certainly, if you have a temperature, that will be something to consider. You might have an infection of some sort, but we're doing temperature checks largely for the psycho-emotional component. People have become accustomed to feeling safe if their temperature is being checked. We already have the screening mechanisms in place. So rather than reduce that level of screening, we're just continuing to provide it. But by no means are we considering that, a catch-all for COVID. We're also screening patients, ensuring that they have masks, making sure their hands are washed, providing sanitation at the entrances, providing masks, and educating people as they enter the facility as well.
Do you think that it would be a good idea for employers to consider the gloves as being a viable source for protection against COVID?
The World Health Organization and the CDC both recommend against the general population wearing gloves as a preventative measure. They would advocate hand washing, hand sanitation, distancing, etc. Now, certainly if you work in the food industry or in an industry where wearing gloves is important, you'd want to continue to do that. But there's lots of side effects you can get from wearing gloves all day long, contact dermatitis, etc. And this is a respiratory droplet spread disease. So you could just as easily touch something with your hand and touch your face and continue to spread a respiratory droplet disease. And so gloves are not going to be the way for the general population to prevent the spread of COVID.
Dr. Tina Ward, would you like to add anything to that?
No, I would definitely agree. We try to reserve the use of gloves for people in the hospital. That's where they really should be used, for hospital staff and clinic staff more than anything else.
So would you recommend for companies to have a preparedness plan to return to work with employees who are and are not vaccinated?
Number one, I recommend getting vaccinated. So if you if you have an opportunity to receive either of the 3 available vaccines, I highly recommend that you avail yourself of that opportunity if you don't have any contraindications, any reasons why you shouldn't be vaccinated. That said, when we're talking about return to work plans, I think that the work environment should be adjusted for COVID, not necessarily surrounding vaccinated versus not vaccinated. So we should be trying to prepare environments where people can socially distance, where people can comfortably wash their hands. If there are high contact areas, if we try to limit those or make sure those are cleaned regularly, or if we don't have to have people in large groups or have large group meetings, if there's other modalities that we can really use effectively, that we would want to prepare those for our work environments, not necessarily centering them around vaccinated or not vaccinated at this point.
I definitely agree with that, because Whitney, what happens is there's going to be a group of people who just don't want to get vaccinated for different reasons, and we have to respect those choices. We try to provide education and give people the information that they need so they can make the best choice for them. But based on that, I would say that I agree with DeVry. We really have to set the environment to protect the employees. That's the most important focus, and that's what I would have you focus on.
So if an employee has been exposed, but they're not showing symptoms, should we allow them to return to work?
If you have an employee who's been around someone who's COVID positive,
yes,
or has been in an environment where COVID is, and then they're not displaying any symptoms, they don't have any fever, they don't have anything so that's a person that if they have a true contact exposure, right? If you're exposed to someone who is in your home, it's your husband, it's your wife, it's your child, and there's a true concern that you may be at risk, then we've been advising those folks to self-quarantine or to self-isolate. That's probably a better word. We've been using the 14 days because that's the CDC guidance. There's some good data around why that might be a helpful time frame, and to just have them limit their contacts. But understanding that you're having those folks distance because you're trying to protect people's lives, their safety and their health. So that would be an important thing to do if they have a true contact risk. Otherwise, though, if someone has been out to dinner somewhere and there's someone who was in that building who was COVID positive, or they don't have a true contact risk and they're not displaying any symptoms, it might be premature to isolate them or to force them to be at home. But I would be collegial with my staff. I would open up the dialogue, and if they feel unsafe or you feel unsafe, to give them the option to be separate for that time period to protect the group.
I agree. And as you know, we have some new guidelines in terms of, like DeVry said, 14 days. We can shorten that to 10 days in certain circumstances, understanding that when we talk about exposure, were you within 6 feet of that person for 15 minutes or longer? That's one of the criteria we tend to use when people say I was exposed. Were you outside? Were you inside? There's multiple factors to consider in terms of the exposure and the risk.
Awesome. Thank you for clearing that up. I know that, there's some people that'll be like, oh, well, I went to go visit a friend and, 2 weeks later, the friend tested positive. Oh, I must have been exposed. Oh, now I'm exposed. And, and it kind of just keeps on bouncing around. So thank you for clarifying some of those, like, those sound like questions that we could honestly be asking on some of those like self-assessments.
And Whitney, I did want to clarify for you when you said that we do look at the date that you were exposed. So if you tell me you were exposed 2 weeks ago and you have no symptoms, you've already self-quarantined or self-isolated long enough. So sometimes you might want to, like Dr. Anderson said, open up that conversation and that dialogue, because you'll find out more information from the person at that time.
Okay. And Tina, we didn't really talk about it too, but we can test, right? So if someone thinks that they may truly have been exposed, we can either rapid test or PCR test, and we can talk about the differences between those two, but just get someone tested to see if they are COVID positive, and that can start a whole different discussion.
And I will tell you, there are numerous companies that are doing that in order to have their employees return to work sooner. So they are having testing on site so that they can increase their employee turnout at that point.
How safe is the facility once an incident has been reported?
So if someone in your business tested positive for COVID, is your environment safe?
Right. So what is an employer to do? Somebody comes in on Tuesday and they say, or they call and they say, hey, I tested positive for COVID, and they were just at work the day before. What should an employer do?
Sure. So I'll talk about what we do in the hospital setting, and then we can kind of extrapolate that to how that might work, in your business setting. We would want to take a contact history, right? So we'd want to know, if you came to work today, but last night you were out at whatever dance party with 30 people, that may be a different kind of concern. But if you're having multiple people in your office test positive, that would be a different discussion. So this is a respiratory droplet spread. So it's not like it's living per se all in your office. It's being spread by the respiratory droplets from talking or from contact so I don't know that the environment itself would need a lot more except for a thorough cleaning. If we have an outbreak in a certain area where multiple people are testing positive, we'd want to make sure all the surfaces are cleaned and wiped down, et cetera. But it'd be important to get a good history of where this person has been and how they may have contracted the virus. Now, we have the staff and the ability and the time to do that. You may not have the time and ability to do that in your office. But I don't know that you necessarily need to shut down your whole office because someone tested positive. I would think that person should be quarantined, their area is cleaned, and then history is done about who they've contacted and how they've contacted them. Tina, open to your thoughts.
Yeah, and actually early on, that's what was happening. I was working at a government facility, and every week or so it was shut down for over 24, 48 hours. And that's not what we're doing any longer. If it's possible, you can wait 24 hours to start the cleaning process, but it's just not reasonable and it's not feasible for most people financially and economically. So I think that we clean the place, like Dr. Anderson said. We utilize all the different guidelines that we have in terms of the cleansing and go from there. But that's pretty much all we can do.
What do you think are some of the precautions that employers can take to provide reasonable accommodations for employees who might be high risk or have family members that are high risk?
I will tell you that is something that's come up numerous times for many people. Like they have some high risk employees who are over 65 years of age, or especially when they're older than that, as well as some who have comorbid diseases. So what we encourage them to do, if you can have accommodations to allow them to telework, please try to do so if possible. If you can let them work in situations where they're not exposed within 6 feet of the public, that's extremely helpful. So any social distancing that you can do and provide is extremely helpful. Any accommodations to make sure it reduces their risk of exposure.
Dr. Anderson, did you want to add anything?
We want to make sure that we create opportunities for those folks to be safe, whether it's via telework or, limiting their access or their attendance in meetings if it's not necessary, limiting in-person contact if there are people that interview staff or they interview customers, that kind of thing.
Are there any natural remedies that we could encourage our staff members to take to help build their immune systems? or just lower their risk in general?
Sure. Eat healthy. Stay healthy. Get rest. Sleep. All the different things that you need to do to decrease your risk. Honestly, I'm not one to take a lot of pills and take extra vitamin D. There's been some research on vitamin D. I don't believe in taking a lot of things unless I'm deficient in them. That's just me personally. But in terms of anything that's going to kill COVID, I'm sorry. No. I would just say keep up on your extra vitamin C in your diet, stay healthy, rather than taking all this echinacea and all the different things that are out there. I personally really believe in a healthy diet with a lot of fruits and vegetables.
When you talked about eating healthy and everything, I was just thinking to myself, like, oh, so maybe the vegetarians got it right.
I will have to admit a couple of things about that. Since I'm Seventh-day Adventist, and a lot of Seventh-day Adventists happen to be vegetarian, they've done a lot of health studies in terms of people who live longer and the health benefits of the vegetarian diet, and it's extremely beneficial. And that probably has to do with a lot of the processed foods and what we are putting in our diet and everything that the animals are forced to eat and different things we're doing. So I don't think you're wrong in that assumption, but I know it's hard to stick to, especially if you choose to go the vegan route.
I would argue as a meat eater that what Tina's saying is 100% true, and it's not COVID specific, right? It's how you're going to be healthy in general to avoid any viral insult or any insult, but none of those things are specific to, hey, if you do this, you're decreasing your chance of COVID. Well, you're decreasing perhaps your chance of infection in general and being a healthier person, which is what we all want to do.
What procedures would you recommend for businesses or people to use as far as PPE?
First of all, before DeVry jumps in, because he has a whole host of things he's going to say regarding that, I want to really add one thing for people. They think that cloth masks are PPE. They are not PPE, okay? So when you're talking about PPE, we're talking about face masks. We're talking about N95. We're talking about real PPE.
So there's a difference between the masks that we recommend people wear to prevent transmission of viral illness or other illness, and buying a cloth from your corner store and wrapping it around your face. They're not the same. But I was going to comment on this idea of personal protective equipment. Understand that the level 1 masks that we're asking people to wear are not really about personal protection as much as it's about preventing the spread of virus and preventing you from infecting those around you. And this is something we hear all the time, but it's kind of counterintuitive. And so we're putting the masks on, the level 1 masks, we're putting them on so that we don't spread our respiratory droplets to those around us. Now, if you're wearing those K95 or N95 masks, you're also reducing the insult that's coming towards you. So you're personally protecting yourself in that regard. In the hospital setting, people wear personal protective gear because they're, in addition to preventing spread to patients, they're also protecting themselves. But what we're asking folks to do out in the world normally is to wear masks to keep the spread from going to people around you. And so just something to think about. And there's a bit of benevolence in that, right? That that when you're putting your mask on, it's not just about you, but it's about your entire community. So. Yep.
And in our community, we like to say, my mask protects you and your mask protects me.
Amen.
What do you think about businesses investing in upgrading ventilation systems or an air purifier or some kind of ventilation supports?
I do feel for them before you jump in, right? The cost associated with them is quite high. So we ask that you make sure that you have a system that's efficiently working more than anything else, rather than upgrading your system and spending thousands of dollars. And on a personal note, I watched my husband do that in our house. I'm like, wait a minute, what are you doing? He has all these air purifiers that are filtering out certain microns in each room, and they're $1,200 each. And I'm like, why? We're protecting ourselves from COVID. So you can get extreme, and you can get an HVAC guy come in and do a consult to your business, and he can tell you how much it is, if it's worth it. So, it goes from everything from $1,000 to $20,000. It's really up to you and what you can afford. versus opening the windows when possible, utilizing other methods, making sure that your HVAC is not blowing air in the direction of other people, so you're spreading those respiratory droplets. So those are the things that the HVAC guy can help you with.
Piggybacking on what Dr. Ward is saying, if you invest that $20,000 in your HVAC system and then your COVID positive patient not wearing a mask or patron not wearing a mask coughs in your face and you get COVID, might turn out to be money not well spent. You might have been better off to socially distance a bit, open up your windows and ensure people can wash their hands and wear their masks.
We probably need to spend a little more time on educating our employees as well. I really think teaching them how the virus is spread, ways to prevent it. That's why you see all these little posters that people are putting up. Social distancing, they put things in the ground that show this is 6 foot, little tape, lots of things as reminders. I think educating your employees is going to go a lot further than paying money on all the HVAC systems.
Oh, now that the governor has opened up the state, he sees a lot of people not wearing masks. Do you have anything that you could say about that as far as out in the public and people not wearing a mask?
Sure. I mean, there's a lot I could say. I will tell you that the medical community in Austin at large was disagreeable. We didn't feel that it was the appropriate time to decrease the wearing of masks, but I understand why there was pressure on a governor to do it. This is an MBA group and there's a business component to this, and they were hoping to, and they are still hoping to stimulate the economy by getting people out and moving and functioning. That said, I would encourage us all to wear masks, to encourage our staff to wear masks. And I think it goes to what Tina was saying. If we educate ourselves and our employees about why we're wearing a mask and how this virus is spread, then I think we'll all understand why we ought to continue to wear that mask for some time, until we have clear indicators that we don't need to do that.
Do you think that people who are not vaccinated or who do get vaccinated, once they get vaccinated, they're good, they don't need to wear a mask anymore? So
my answer is you should absolutely wear a mask even after you've been vaccinated. And this is probably important to think about. We're getting vaccinated for COVID-19. The reason why we're getting vaccinated against this coronavirus, because there's tons of coronaviruses that just cause colds, but we're getting vaccinated against coronavirus because in some subsets of people, it kills them, or it has a high morbidity where they get admitted to the ICU or the hospital. So that said, you can get a COVID vaccine and still come in contact with the virus, and you yourself can, with the antibodies provided or with the ones you develop, fight it off and not get sick even at all, or only get a little bit sick or not even notice it. That's the purpose of the vaccination. But you could still, for some potential small period of time, become a carrier or spread this to a loved one, a grandmom, or someone in your community. And so we want to continue to wear our masks to protect other people who may not have that same immunity or may not be able to get the vaccine or maybe haven't gotten it yet.
Do you think that what percentage of Americans do you think would need to be vaccinated before we wouldn't need to do like these hybrid models and we can kind of just resume normal life again?
So that's a really challenging question. And I'll tell you a couple of reasons why. So my answer would be, I'm not sure, and neither are, big names in this, like Dr. Fauci or the CDC or World Health. They're not sure when that's going to be. And here's why this might be. This virus, like all viruses, mutate. So there's been some 1,600 variants of COVID-19 identified in the United States. So it's continuing to mutate. And some of those have been more infectious, some less infectious. And so it's hard to say when we're going to get to a point where even with the mutation, we are safe enough that we're not having like a mortality risk where people aren't getting sick and dying. The vaccination may help with that. We may start to see reports late in the year or even early next year that show us that the risk is so low that it doesn't matter. But I would be listening to World Health, to CDC, to all of our hospital systems to hear what people are reporting, understanding that it may be that never happens. It may be that our new functionality is that we wear masks or that we get vaccinated regularly like we do for the flu and other things.
Oh, right. What about smaller companies? What can they do to kind of ensure, sanitization and those types of materials and safety materials? So that their staff members can be protected, but also monitoring expenses.
So I do think that the things you touched on are important. Having hand sanitizer available for your customers and your staff, having spacing in your waiting rooms or in your sitting rooms is important, and that may be a concern. providing masks, you should require that your patrons have the mask, and most people will bring their own mask. But in those rare instances where someone doesn't have a mask, maybe having extra to provide, or certainly providing them for your staff, and those may be added costs. But as business people, you may have all heard this term, this VUCA, right? Volatile, uncertain, things are complex, it's ambiguous. This is how we plan. And so there is no real normal. Things change constantly. And so just being flexible, being adaptable, and just adding these new small costs to your budget, may create new revenue streams. You never know. But I agree that having hand sanitizer, having masks, having spacing, those are the things you'll need to do to prevent the spread of COVID in your work environment. Who could have known that COVID would be so crazy? But now we recognize that, okay, we'll have to do things a little different and find ways to adapt. That's what businesses do.
That's all the questions that I have on my end, Dr. Anderson. Thank you so much for joining us tonight. Thank you for taking the time, making the time to join us. And I definitely want to give a shout out to the National Association of Black MBAs, the Austin chapter, for inviting me and helping me to facilitate this, and also having a chance to meet Dr. Anderson and Dr. Ward as well. It was such a pleasure. Thank you for all your hard work. Thank you for, fighting these health disparities in our communities. It is a serious problem. And every time, a Black doctor gets their coat, somebody in heaven is smiling.
Thank you, guys. Thank you for all that you do. Thank you for giving me this opportunity. So have a wonderful night.
Great. Once again, folks, as Mr. Bauer says, make sure you're using that chat. Make sure you're dropping all your LinkedIn information.
Cardi B. When we lock eyes, I look away from time to time, fall asleep to right now. Just wanna lay with you all night, feel your body next to mine. Boy, I need you now.